Today we have the pleasure to have here with us Adrian van der Hoven, Director General of Medicine for Europe. Welcome, Mr. van der Hoven.
Thank you very much for having me.
Mr. van der Hoven, there is a strong discussion about the revision of the European pharmaceutical legislation that recently the European Commission presented. As Medicine for Europe, former AGA, you highlighted some critical perspectives, some issues. Um, um, Starting from the lack of a strategy in the long term for supporting the off-patient industry. What do you mean on this side? Which issue do you see from in the long term from a strategical view for this revision of the pharmaceutical legislation?
Okay, well, thanks a lot. So I think, first of all, it's important that the legislation is being revised because it's been over 20 years since the last time it has been updated. So it's really now out of date. So it's important to update the legislation. I think what has really changed in Europe is that in the past, the European Union only looked at how medicines were authorized from a safety, quality, and efficacy point of view. And now, without ever asking, do the patients in the end get these medicines? And now the European Union is saying, okay, now we're going to do safety, quality, and efficacy, and we're going to make sure that patients everywhere in Europe get the medicines, because in some countries, especially the less wealthy countries in Europe, really they don't have good access to medicines. So the Commission now is saying, okay, now we're going to do something to try and improve the access to medicines. So that's a good thing. It's something, of course, we support. How they're going to do that, there are a couple of ways. One that's good for our industry is that the Commission is going to ensure stronger competition from generic and biosimilar medicines. So mainly by preventing any abuse to delay the entry of generic and biosimilar medicines. For example, in Italy, you have a system called patent linkage, which effectively delays when generic medicines can enter the market, so when the patients can have a lower cost medicine. And that kind of thing, the Commission is trying through this legislation to limit that type of activity. But also in some other countries, they want to allow earlier generics if the new expensive medicines are not available for the patients.
Thanks. And your association explained that extending the data protection of drugs already in the market should cause a damage to the companies of equivalent drug and biosimilar. Which is your view, the view of your association, and your view on this topic?
Yes, indeed. So in the legislation, the Commission is trying to solve the problem of not enough new antibiotic medicines against antimicrobial resistant strains of bacteria. So of course, we support measures to tackle antimicrobial resistance. We think it's a very, very important issue. However, the way the Commission is doing it, we do not agree at all. What they are proposing is that if you develop a new antimicrobial drug, you'll get a voucher or something like a coupon, like that you would get in the supermarket, and you can sell that coupon to another company who can put that voucher onto a different, very, very expensive drug and effectively extend the monopoly. So what this will most likely mean is that for some cancer drugs, they will have a longer monopoly period than they do now in order to, if you wish, pay for the antibiotics. And that's something we fundamentally disagree with, because normally the reward for innovation, which is fine, should be on the innovative medicine, not a right to buy a monopoly. And so that's the main reason why we disagree with that. And also because it will be very, very expensive. The Commission's own study shows that this is about 5 times more expensive than if the EU just bought these medicines and distributed them to the different countries. So we actually believe that that would be a better solution, just for the EU to buy the reserve antibiotic medicines or antimicrobial medicines, and to find an arrangement with the member states to make sure the patients get it.
Mm. And In Italy, the president of the Pharmaceutical Association Farmindustria strongly criticized the reform project, saying that mainly it will affect the competitiveness and attractiveness of the European Italian situation from an industrial perspective, and it should even impact the access to care and innovation for citizens. Which is your opinion? And do you see that we should find a good match, good compromise between the different needs of the different industries, but even, of course, in a collaboration between public and private, also because we understand finally, even in this during this pandemic era, that we need a strong industry. We need even a pharmaceutical strategy, industrial strategy for Europe, but even specifically for Italy, because otherwise we can face many challenges, such as the pandemic ones.
Right. So there are some issues where I agree with the president of Farmindustria and some issues where I disagree with the president of Farmindustria. So where I agree with the president of Farmindustria is that, unfortunately, the pharmaceutical package or legislation as proposed by the Commission does not include a clear strategy to support the manufacturing of medicines and active ingredients in Europe. As you probably know, Italy is the biggest manufacturer of active pharmaceutical ingredients in Europe and one of the biggest producers of medicines. There are other big producing countries, but Italy is really among the very, very biggest in Europe. And but in reality, we've been losing our manufacturing competitiveness to Asia for many, many years. And it's time now to restore Europe's manufacturing competitiveness, also from the perspective of security of supply, both for active pharmaceutical ingredients and for medicines. And so we would like to see also a policy to support investments in manufacturing. Our industry is investing in many countries in Europe, including in Italy, but not receiving any support from the EU. And we've seen we're not alone in this, because 20 member states have just signed a paper calling for a Medicine Security Act, which we also call for, and pushing the Commission in this direction. So we hope this will go forward. And I think we definitely agree with the president of Farmindustria on that point. Where we disagree, however, is that this legislation is going to have a very, very negative impact on innovation in the pharmaceutical space. It will have an impact, but not at all as negative as portrayed, for two very simple reasons. One is that the modulation of incentives that the Commission is proposing actually could extend, if you meet all the criteria, beyond what currently exists today. So what currently exists today is up to 11 years of monopoly or exclusivity, if you wish. But if you meet all the criteria, you could get 12 or even 13 years. So it's actually in some cases an extension. If you don't meet the criteria, then it's shorter. So then you lose indeed. So industry has to meet the criteria. And the second key point is, beyond the incentives, there is no change to the patent system in Europe. So we will still have the 20 years of patent plus the up to 5 years of SPC, which kind of extends the rights of the patent. This is unchanged. In fact, the Commission is going to extend that by creating a unitary or a unified SPC for, let's say, one SPC for all of Europe. So really, on the patent side, the innovative industry is still super well protected, and I don't think has a lot to worry about. I think it's there. I just do not agree.
Okay, thanks. But at the end, on your side, in your vision, how Europe, the European Commission, can effectively support a strong pharmaceutical strategy, industrial strategy, both on production and the research, and helping all the citizens accessing to the best care with a good perspective in terms of sustainability, of course.
Yeah, absolutely. So, as I mentioned already, I think there should be a clear European policy for the manufacturing of medicines and active ingredients, not just for Italy, but for the all of Europe. But Italy would obviously be a big beneficiary of that because the security of supply does matter. It's a very, very critical issue. The security of medicines is as important as the security of energy supply, for example. And we know the lessons learned due to geopolitics and things like that in this space. So we need to really invest here. The private sector is investing, but we need the support from the EU as well. A second key point, we are supportive of innovation. There are some good innovation measures in the legislation which will help Italy because, for example, there are some incentives for what we call value-added medicines, for repurposing of medicines, which are new, which have never existed before, and which could be really good for a lot of very small companies that do research and development in Italy. And the third piece, I think when it comes to other forms of innovation, we need to start recognizing that the problem in Europe is really one of how to create a closer relationship between universities and the industry. In many countries in Europe, we consider the university to be one side of the earth and industry to be the other side of the earth, when in fact we need to collaborate because the research in the end in universities, it has to serve a purpose for society, right? If you want to do research on medicines, eventually you want newer and better and improved medicines to the patients, right? In practice, every single medicine is eventually sold by a company. So we need that alignment. Of course, it has to be fair. The universities need to get rewarded for the research that they have done. I think that is pretty well done. But we don't have enough collaboration in most European countries. In Italy, it's a problem. In France, it's a problem, and it's a shame because we have good researchers. Look with COVID-19. Three of the vaccines were developed in Europe thanks to the excellent research and collaboration. But we could do more and we could do better in this space. But I really think we need to look again at how we cooperate industry and universities. These cannot be two different worlds. We have to live in the same world and cooperate.
Thanks. It's particularly true for even for Italy. But in your perspective, the European data strategy, the European health data space, the new European Data Act should help in the direction you mentioned before.
It should help. I think this is definitely the intention. And here, really, Europe should have a massive advantage over any other region in the world because we have in Europe centralized healthcare systems, managed by the government. And so, therefore, the data is actually well organized and potentially available to dramatically improve research, which could mean that we could develop the research much, much more quickly than any other region in the world. So I think there's a huge opportunity. What I do feel, though, in Europe is a problem is that in as much as we have to respect privacy, this is very important, in particular in the healthcare space. Most of this data can be aggregated, anonymized, so you don't need to know that it's my Adrian's data, okay? But this data can be very, very relevant for the development of novel medicines or treatments for patients. And so we need to acknowledge that if we don't have a certain volume of data from individuals, anonymized, kept very secure and private and all that kind of stuff, which is very not that complicated to do, we're not able to advance. And in Europe, we go too far, in my view, in restricting these things. We should really have this collaborative effort, respect the privacy, but also use our advantage. Europe has a massive advantage. Let's use it to come out on top and develop a lot of better medicines and better treatments for patients.
Thank you very much, Mr. Van de Hoven. It was really a pleasure to speak with you. Very insightful, and we look forward from more updates from you. And of course, as your words underline, it's critical in this moment to shape a new focus, a new direction for the European legislation on pharmaceutical industries, because it's critical for all the healthcare system, for all the health of the European citizen, and even for all the industries and the economy. Thank you very much. It was a pleasure.
Thank you very much for having me. I really enjoyed it. Bye-bye.